Good evening. I'm deeply honored to accept the SAMRC Presidential Award. I receive it with gratitude and on behalf of the patients, families, nurses, clinicians, lab scientists, trainees, as well as my collaborators whose commitment makes specialized care, meaningful research possible. I'm a clinical hematologist and my career has focused on improving outcomes for people living with bleeding disorders, conditions that have remained under-recognized, under-resourced, and entirely treatable with science systems and access aligned. Today, I serve as the academic head and chief specialist in the Department of Molecular Medicine and Hematology at the NHLS and the University of the Witwatersrand. As a full professor of hematology at Wits and as the head of clinical hematology at the Charlotte Maxeke at Johannesburg Academic Hospital. Additionally, I direct the World Federation of Hemophilia International Training Center in Johannesburg and clinical hematology research at the Wits Health Consortium. My research is centered on advancing novel therapies and closing the evidence gaps. Over the past decades, I've led over 120 multi-center grant-funded international clinical trials, each aimed at translating scientific progress into real-world access. Equally important has been the investment in people. I've been involved in training, mentorship, and the development of systems that ensure specialized care is not episodic but sustainable. I've also had the privilege of serving the profession twice as the president of the South African Society of Hematology, twice as the president of the College of Pathologists of South Africa, and twice as the chair of the Medical and Scientific Advisory Council of the South African Hemophilia Foundation, alongside multiple roles on scientific boards, committees, as well as editorial panels. Across 3 decades, I have co-authored more than 350 peer-reviewed publications. What matters most to me is that this body of work has helped place African data, African patients, and African priorities firmly within the global health discourse. Recognition I've received both locally and internationally include the honors from major professional societies that reflects the collective effort of teams and the trust of patients who participate in our research. My association with the SAMRC has been especially meaningful, having served on its board for 9 years, including 2 terms as the chair. I've witnessed how sustained investment in research strengthens a nation through knowledge, capacity, innovation, and measurable health impact. This presidential award, therefore, represents both recognition and responsibility. A responsibility to continue advocating for a future where specialized care is not determined by geography, where advanced therapies do not widen inequities, where every person with a bleeding disorder can access the standard of care that modern science has already made possible. Thank you to the SAMRC for this honor and for your steadfast commitment to research excellence and national progress. Thank you to my colleagues, my collaborators, as well as my trainees. Last but not least, I want to thank my family whose support sustains the work behind the work. Thank you.